All right, welcome everyone to this afternoon's mini More Profit Roundtable. My name's Breck Rice. I'll be your guide through the next 20 minutes of sharing with you some exciting information for community pharmacies. So I appreciate any of our care consultants that are working with community pharmacies that have invited their friends to be here today, and obviously welcome all of our community pharmacy owners and those who work with community pharmacies. You are doing God's work. We love you and want to support you any way we can. I have been around community pharmacy for 22 years now, and will do anything and everything I can to help pharmacies be more profitable. My company, ServeRx, does revenue cycle management for community pharmacies. We have about 20,000 pharmacies in our network. I am the preferred vendor partner for all of the PSAOs, all of the pharmacy service organizations that do the contracting for community pharmacies. We are their preferred provider. And so that's a wonderful opportunity for me, but it's also a sad opportunity when I get the daily updates from our PSAO partners of the closures that are happening in the country. Those closures are due to poor reimbursements that are coming from the bad contracted rates of the PBMs. The PBMs continue to drive down the reimbursement rates for community pharmacies. This should be no secret to those community pharmacies that have joined us this afternoon. The PBM and insurance mafia are aligned against you. And one of the reasons why I've gotten involved with PBM reform. So I do host the PBM Reform podcast on the Pharmacy Podcast Network. There's some great information there, but the whole idea for the podcast is to bring in lawmakers, people like Buddy Carter and others that are in legislation to bring light to the situation and try to get some relief. It is a slow process, but we are making progress. One of the most recent benefits that we've been able to help patients and community pharmacies is remove gag clauses out of pharmacy contracts. At one time, patients would come in and they would be told what their copay was, even if the drug cost was well below the copay. So maybe their insurance copay was $37.50, but the actual cost of the medication was only $10. The pharmacy was not allowed to tell them that. They had to collect the $37.50 so that the PBMs could get their pound of flesh. So we have taken that gag clause out of contracts, and we continue to work and make positive changes there. But it is a slow process. So that's the reason why I do the More Profit Roundtable, is to help community pharmacies continue to bring in new products and services that will help their pharmacy. Everyone is very interested in clinical services. For the last 2 years, pharmacies have been looking at what they could do to get involved in clinical services. And so I have outlined the 3 steps here to success. And it starts with remote care today, the remote therapeutic monitoring program. The reason we start with this program is that there is no cost to the pharmacy to start. There's no additional credentialing that's needed to be done. There is no additional staff members that are needed for this program. And it is a new program covered by Medicare, both Part B and also a Medicare Advantage. The pharmacies, you don't need to worry about being credentialed with Part B. We know you're credentialed on with Medicare Part D for the medication side. You don't need to worry about the Part B side. That is completely taken care of for you in a turnkey solution that Remote Care Today, or RCT, brings to the table for you. I do want to just touch on step 2 and step 3. We'll spend the majority of our time this afternoon discussing RTM. But because there are so many pharmacies who have either tried this or started the process to get credentialed, or were super frustrated about the situation that they might have gotten themselves in, there are answers, there are solutions. And Remote Care Today has partnered with IPPN to help get you those answers, because I can assure you there are more wrong ways to do it than right ways. And I've seen them all. And I've unfortunately seen friends of mine that have spent thousands and thousands of dollars to try to get set up and still not get across the finish line. One example was a gentleman, a friend of mine that owns a pharmacy in Arkansas that spent over $56,000 to try to get credentialed. So we want to avoid those pitfalls, and we have a solution for you. The third step here is a full brick and mortar clinical room that operates just like a clinic, but in partnership with local doctors, not taking the attribution away from your local doctor. So it's actually an extension to your local providers and partnering with them. That is owned by the pharmacy, but completely managed and even staffed for you. You can do 1 and 2 at the same time. You can do 2 without 1. You can do 1 without 2. You just can't do 3 without 2. Okay, so hopefully that makes sense to you. Let's move on to the RTM program, because it is absolutely amazing for community pharmacies. Remote Care Today is needing your help. They have this amazing platform that I'm going to show you a demo of here in just a minute, that is addressing two major concerns for your senior population. Uh, Besides their concerns, every senior wants to stay independent as long as they possibly can. They want to keep their driver's license as long as they possibly can. They want to live on their own as long as they possibly can. This program, RTM, is literally extending that opportunity for seniors by 7 to 8 years. This is an amazing platform that Medicare is behind, because they know how much they're spending on things like a fall. If a senior has a fall today, Medicare is paying over 50 billion with a B, on those services for that senior who has fallen. They estimate that that is going to increase to over $100 billion in the next 4.5 to 5 years. So they are 100% behind this program. The two main concerns of seniors is loss of memory and not having balance any longer. This addresses both of those. So even though it's a new program, it is just rolling out, and Remote Care Today needs pharmacies' help in administering this, and I'll show you what your responsibility is as a pharmacy for doing that. And again, it doesn't take any additional staff or any money to set up the program. The three buckets that Remote Care Today works in is the Chronic Care Management, or CCM, and the Remote Physiological Monitoring, or Remote Patient Monitoring, where there's a wearable device involved. Those two programs you can eventually expand into, but they do require some additional steps, and it needs the primary care providers sign off on it. So they basically prescribe those two therapies, where remote therapeutic monitoring does not need their PCP. This can be set up and run completely autonomously through the program and platform that Remote Care Today is bringing to you. So let me show you this quick little minute and a half explanation about the pharmacy program.
America's 20,000 independent pharmacies are trusted anchors in their communities, but many today are under financial stress. Brain Health Plus offers a simple way to support your patient's well-being while adding new revenue to your pharmacy. Brain Health Plus is Medicare covered by both Medicare Part B as well as most Medicare Advantage plans. It's a remote therapeutic monitoring program that helps prevent and often reverses memory loss, cognitive decline, and fall risks. It's backed by science and designed to improve balance, cognition, and overall health. Patients access the program from their smartphone, tablet, or computer, enjoying fun daily activities, brain games, and motivational content that keeps them engaged and looking forward to each session. The platform includes medication tracking, daily reminders, potential drug-to-drug interactions, and geofencing alerts, so the family can know if their loved one is in the hospital or ER. We also provide your patient with an advanced technology to scan their face and track their health. with a 30-second AI-powered facial scan to monitor vital signs from home with 96% accuracy and 98% repeatability. Best of all, we make all of this turnkey. We handle all onboarding, education, patient support, and Medicare billing. You simply offer the program and earn ongoing revenue for every enrolled patient. Brain Health Plus is easy for you, powerful for your patients, and great for your business. Click the Book a Call button to schedule a demo and bring it to your pharmacy today.
I really love that geofencing feature that notifies loved ones when a senior ends up, at the ER or an urgent care. That's an amazing feature, but a tremendously powerful platform that is launching this month called Brain Health Plus. And uh, what the senior is going to get out of this again is daily exercises that are available to them that are only about 8 to 10 minutes. They can to qualify and have it covered by Medicare is basically every other day. So it's 16 times a month that they would engage in the application. That will be helping with working memory, memory recall, response time, balance and coordination, and is also helping reduce falls and keeping patients independent longer. Amazing program. I want to show you, it kind of highlighted a little bit of the fun games that they're going to be doing. But let me show you this in this next video. And I'll stop it at a certain point because I want to point out some data gathering that's happening because this goes hand in glove with what the pharmacy will be doing in helping with this program.
We all know that physical activity is key to staying healthy so that we can continue doing the things that we love to do. But it's not always easy to stay motivated. That's where we can help. Instead of a typical exercise routine, we've made exercise an interactive experience. You'll be skiing down the Italian Alps, climbing rocks in Thailand, and cycling in the Tour de France.
So I want to pause it there. If you look at the lower right-hand corner of your screen there, you'll see the little wireframe on the gentleman that is doing the moving the bike from left to right. This is more than just controlling that avatar or making the little guy go left, right, or pedal. This is gathering data. So when the patient needs to lean to the left and then lean to the right, it can tell if they're a little less balanced, leaning one way or the other, so that data can be collected and the coaches can help strengthen. If they're weaker leaning to the left, they're going to work on exercises to strengthen the left side.
All the while doing exercises that help promote balance, strength, endurance, and coordination. How does it work? This program uses your computer's webcam to detect and measure your movements. For example, in this ski activity, when I shift my weight to the right, the skier goes to the right. When I shift my weight to the left, the skier goes to the left. All right, have some fun and enjoy the program.
So remote care today is going to provide all of the marketing materials for you. They're going to set up a landing page for your pharmacy. They're making it as turnkey as possible so that you can get this program out to as many seniors as possible. So even bag stuffers and rack cards and things like that will be available to you. I've heard some talk about actually printing the information on the bags because that'll be more visible than hoping that the patient takes the information outside of the bag rather than just take the prescription out of the bag. A lot of successful pharmacies setting this up will do their own little welcome video, and Remote Care Today will actually script that out for you. But basically, it'll be a welcome from your pick or whoever the face of your pharmacy is. Maybe it's a tech that's been there for 15 years that the whole neighborhood knows and loves. Have them do the little welcome video, and then basically say that we reviewed this program that's going to be so beneficial in helping our seniors stay independent longer, addressing their two main concerns. Watch this little 2-minute explainer video. and then they watch the video, and if they're interested, then they hit enroll. So all of that's going to be set up and provided for you. Your input will be that 20-second little intro video on there. What when I said goes hand in hand with what the information gathering or the data gathering for the exercises, this is what the pharmacy's responsibility is. So you will see here in 30 seconds exactly what you would need to do in order to be eligible for the administrative service fee.
Working with our program is easy for you and your staff. If you choose to review your patient's monthly progress and earn administrative services fees, you will be sent a weekly email notification reminding you to log into your portal and review patient assessments. You or an appropriate member of your staff will review these reports, review the summary data for the patient, add your notes, and then simply click the sign-off box next to the record. It's that easy, and it's that fast.
It literally takes about, between 30 seconds to a minute for each record. What you're doing is you're identifying when the patient is plateauing in different areas, or if they're struggling in an area, you'll be able to notate that. That information is then sent back to the coach to help adjust their program so that they're continually showing improvement. Now, patients will eventually graduate off of the program. They can re-enter it at a later date, but you will have ebbs and flows. So you'll constantly want to be recruiting patients into the program. So the next steps to get started are simply your care consultant that invited you to this demonstration can send out the paperwork. It'll include the business associate agreement. And then the most successful pharmacies in recruiting patients use a two-prong approach. They have the signage, and they have some even have a little monitor that has the explainer video on loop. You've got the bag stuffers. You have your staff that knows about the program so that they can be encouraging patients to scan the QR code and check it out. But the second prong of that is to allow remote care today to help you with that outreach. There will never be a third party. Your patient data is completely HIPAA protected. It's always through your own outreach system. So if your pharmacy system has the SMS text capabilities of doing refill reminders or sending out, hey, it's flu season. I know my community pharmacy reminds me that I'm old enough to get the shingles shot now. So I get that text about once a month. Whatever those notifications are that you're sending out, that's the same system that will be used. Even if a outbound phone call to a patient is made, it's coming from your phone number. So it shows up on the caller ID. It's called number mirroring. So it is all the information is coming from your pharmacy. It's totally up to the pharmacy on where their comfort level is and how much you want to get engaged in the outreach. But as we show here in the side there, you can see that just putting 100 patients onto that program can generate $2,500 per month. So that is a residual month after month. So 200 patients going to be 5,000. You see where I'm going with this. So like I said, the most successful people that are setting this program up are approaching it from a two-prong. So the pharmacies are marketing it to their patients, and then also allowing remote care today help with that outreach as well. As I mentioned in the steps early on, there were two other steps into clinical services. I'm just going to touch on this because these four pillars are the pillars for success in doing those clinical services correctly, and actually having a software platform that is user friendly and can handle all your patient engagement, because you can't do clinical through a pharmacy system. They're two separate systems. So you have to have an EHR, EMR platform, and those are super expensive if you've looked into that. those platforms are thousands and thousands of dollars. Plus, they have, a $400 or $500 monthly license fee for Cerner and I can't even remember the other big one, but Epic and Cerner. That's probably the two main EHR systems out there. You have to have collaborations with the local doctors. That is all 100% provided for you through the IPPN program. So this is the fastest growing community health collaboration in the entire country, already in 16 or 17 states. There's several hundred pharmacies that are already enrolled and several thousand doctors because there are care gaps that this program fills. And so that's why the doctors are signing on for the program. They want to improve their quality measurement scores. And they just don't have enough time to get to all the well care visits. They're too busy taking care of sick patients. So this is where you can step in and help. This will turn a $20 flu shot into an $85 preventative service. So these are just some examples of some of the CPT codes that can be used. All your 99391 through 99397 are the preventative codes. You see your office codes here. And the other big opportunity besides vaccinations is continuous glucose monitoring. On the hour-long podcast this morning, our title sponsor, RX1 Shop, mentioned the cost that they have on the latest G7 Dexcom glucose monitor, and their price point on that is the lowest I've seen at 118 is the wholesale price. If I were a pharmacy owner, I would give that monitor to all of my patients that need a continuous glucose monitor because your reimbursement is $150 per month for every patient that has that. So you've paid off the monitor basically in 1 month, and then it's 150 for each consecutive month. So just some of the low-hanging fruit for food for thought on going through the steps for getting fully credentialed. And like I said earlier, there are more wrong ways to do this than right ways, and that's why Remote Care Today is partnered with IPPN is to navigate those waters and make sure that you're doing it the right way. The third phase of clinical services is the brick and mortar clinic. This is a BRIM program for our RX wound consultants that are on the call today. I saw a few of you here today. This is an exciting opportunity because you need a HIPAA compliant clinical room in order to utilize your program with wound care. And so this is a fantastic collaboration with RX Wound and Brim Wellness. Again, it's completely managed and even staffed for you. But why this fits so well with RX Wound is it requires an MD or a nurse practitioner in order to meet with the patient that is having wound care done. It is really expensive for a pharmacy to have an MD or a nurse practitioner on staff. So let's look at the second leg of this stool. That is the talent exchange. You would basically stack up all of your appointments for wound care on one day. You would post that day as a clinical day on the system, and then a nurse practitioner would go in and fill that day for you. So it's like Uber for medical practitioners. So you post a shift, they fill the shift. Fantastic program. And then the third leg of the stool is probably what I'm the most excited about. It's a financial vehicle for pharmacies. Not only would you be able to use the pharmacy fund to build out your walls, bring in your hand washing station, put the equipment in that's needed for the clinic, but when you pay back that pharmacy fund, you become a cooperative member of the fund. So now not only are you helping more community pharmacies get their clinics set up, but you're earning an amazing return on interest for any money that's in the fund. So that is pretty much the program today. I will open it up for any questions at the end here, but I want to make sure all of our community pharmacy partners know to get with their care consultant that invited them here today to get the paperwork started for the RTM. There is already a little bit of a backlog on the implementation or in onboarding calls. So you want to make sure that you get in the queue to get your onboarding done as soon as possible. So get with your care consultant to make sure that you get the enrollment process started there. And again, there is no capital investment for starting with remote care today. If you do want more information about IPPN or BRIM, that is a separate demonstration for you. We just touch on it today to let you know that those opportunities are there. And it is kind of a progression. Start with remote therapeutic monitoring and then expand into clinical services from there. But thank you so much for your attendance this afternoon.